So I've been on quite a health journey. I started having migraines, really intense migraines and headaches about 16 years ago, and it was very sudden. I was pretty young, and nobody could explain it. We kind of went through, just because of how sick the migraines and how intense they were, and because of my age, everyone kind of jumped to, oh, it's got to be like a brain tumor or brain aneurysm or something, one of the really big things, they check for. And so we did MRIs and CT scans, did loads and loads of blood work, and just kind of ruled one big thing after the other out. Really scary for a little while. Went on a bunch of different medications. Went on eventually birth control because I thought they were hormonal headaches. Went on a bunch of antidepressants thinking it was a depression related thing. And just for anyone who might struggle with that, just know that chronic pain is depressing. So don't let people fool you. And yeah, so we kind of ran the gamut for years, and I couldn't tell you how many doctors, and they just never went away. So it kind of became more about pain management and just trying to live the fullest life that I could as best as I could. Lots of diets, lots of protein shakes, lots of supplements, lots of different chiropractors, neurologists, pulmonologists, cardiologists, and any ologist really. That's what we saw. When I first started seeing Dr. Taylor, I was taking some pretty intense pain medication. If you've ever been on pain medication, it is very addicting and can be very toxic for your body with a lot of side effects, and there's not really, like for me in my case, they just kind of kept upping them as my body adapted. And then I was also on a monthly injection. I took it twice a month, and it was to prevent migraines and prevent headaches, because when I would get migraines and headaches, they would completely derail me for days, sometimes 11, 12, 14 days, where I would just be completely bedridden, couldn't really eat or drink, couldn't work, and it was really insufferable. And even on the injections and even on the high doses of pain meds, I was still facing several migraines a month, probably like close to 10 to 15 migraines a month that lasted days, and high intense pain meds. Even with all of that, I was still suffering every day from headaches and chronic pain in addition to the migraines. After seeing Dr. Taylor quite a bit, he was able to get me completely off of the pain meds and the injections. I was really pleased at Dr. Taylor's willingness to listen. He gave us a lot of time right at the gate and didn't make any promises, but he did offer a lot of hope at the same time, which wasn't something that I was used to hearing. I was used to hearing, oh, I can fix you. And in my head, I'd be like, you don't know me. Like, how can you possibly promise me something like that? But Dr. Taylor listened, and he tried a lot of different things. He listened to all my concerns. It's been now a year, and I have not had to go back to any of those medications. And I've still been able to do everything that I want to do and be able to sleep through the night, which is really incredible. When I left a year ago after 6 weeks of treatment, pretty regularly, pretty much every day or every other day, I was down to maybe 1 or 2 migraines a month, and I was also living relatively pain-free.